Aloha! Welcome to Defense Heart TV. I'm your host, Sifu Robert Realm. Today's show is about body targets and what happens when we strike them. It features Dr. Mike Savona, Hawaii's Doctor of the Year for 2003. So stay tuned for the effects of striking vital zones on Defense Heart TV.
Thank you for coming. You're very welcome, Doug. The doctor is going to be talking about the different effects of hitting vital zones and also a few other things about martial arts relating to the body.
My name is Mike Savona. I'm a physician here on Maui. Have been so for the past 26 years. I'm board certified in internal medicine, and I teach at the medical school. I'm an assistant professor of medicine there, and also an assistant professor of cancer research at the Cancer Institute in Honolulu as well, that's affiliated with the medical school. I've taken up martial arts, which has always been something I've wanted to do, so Sifu Doug has taken me under his tutelage, which is very, very good. I was watching the black belt performance yesterday, and I was saying, my God, I'm going to be loaded with Ben Gay by the time my time comes to do something like that. But we're going to talk a little bit about striking vital zones and what not to hit and what to hit. The first thing I wanted to show was the skull, and I want to show it for two reasons. One, because I think everybody who deals with martial arts that's going to be involved in any kind of competition or even self-defense always thinks of the skull or the head as something to strike at. But the skull is purposely made with a lot of thick bone to kind of cover and protect the master computer up here. And while blows to the head are certainly things to think about, they're a little damaging to the one throwing the punch. You know, prize fighters do this but wear gloves, and they wear them for a reason. And certainly striking the head, while it will cause some damage to your opponent, usually stunning them, perhaps some buzzing in their ears, it may not be the most appropriate target to think about on the head. Okay, so there's a number of areas that we want to just explore to look at. If you were to look at the head itself, there's a couple of things that are very, very sensitive to touch, and including the general face itself. When I think about the face, I think about, well, what are the areas that are the most sensitive there, and what are the areas that you might want to include on your strike list if you are going to throw a punch at somebody or any kind of a strike. One of the first places, of course, to think about is the eye. Now, the eye is a little peculiar. If you think about your own face and you look at the bony structure is such that the bones around the eye do a very good job of protecting it. If you were to strike somebody with a fist, you know, a typical fist that you might throw as a weapon, the bones around the eye are going to absorb the blow. Probably not going to strike the eye itself. Now, if you were to use something different, middle knuckle fist, a phoenix eye, or an eye poke, then you have a better chance of striking the eye. Now, if you strike the eye, what can happen? Well, it's very painful, I think, as any one of us have known if you ever have been poked in the eye, but there's a number of other issues that can occur. First of all, the eye is a globe, and it's filled with a gel-like liquid that we call vitreous humor. Any pressure on the eye transmits pressure through that humor, or that liquid, to the back of the eye where the optic nerve is. Okay. When that happens, a number of reactions occur. In addition to the pain that someone feels when you strike their eye, one of the profound reactions that occurs is this transmitted back to the brain creates a lot of traffic in the 10th cranial nerve, which is called the vagus nerve. Not the Las Vegas nerve, but the vagus nerve. And what the vagus nerve does, the vagus nerve has a lot of effects on people. We use this in clinical medicine to treat people with rapid heart rates. I can get somebody's heart rate to go back to normal by applying pressure to the globe of their eye. You can do the same thing to somebody who you strike in the eye, and what happens is the heart rate will slow, usually into the 30s or 40s. At the same time, the veins in the legs dilate, blood pressure drops. So this can have a very profound effect on somebody. It doesn't take a lot. Just pressure on the top of the globe of the eye. In addition, of course, you can do a lot of damage to the eye. And, you know, with a lot of force to a blow, you can really create a problem, a tear in the eye, which would be a disaster. and a dislodgement of the retina, which could lead to blindness. So it's an area that you want to treat with respect when you're doing this as part of competition, but it's also something that you can keep in mind as a part of your weaponry. So it's something to keep there. The other thing is that, as this tends to show here, the eye sits sort of floating in the orbit, which is what we call the bony structure around it. And then this white around the eye here, which we call the tunica albuginea of the eye, and over at the filmy tissue is called the sclera, fills out the rest of that cavity, and there's muscles that hold it in place and allow us to move our eyes. But this can be proptosed or enucleated. You can actually hook it and pull it forward. That's often done in surgery when they have to get to behind the eye to deal with something behind it. So another area for strike would be hooking from the side. Okay, so got to be careful when you use your hands here. Other areas we'll talk about in a minute are the ears. Another very sensitive area is the nose, and especially the front portion of the nose here that we call the frenulum. Anybody who wants to try this, put your thumb there and push a little bit, and you'll feel that it's very uncomfortable. Now the problem with this, though, is that when you press against it, it's very easy for an opponent just to tilt their head back. It's hard to hold it. Okay? So your hand will slip off it a lot. But this is a very sensitive area, and Sifu Dennis and I were talking about this. This is one of the areas that we use when someone's in a coma or feigning coma, to see if they really are in coma or to bring them out of it. Because the pain here is pretty intensive. And a lot of people, even if they're in a deep state of sedation, will start to stir when you do that. So it's an area to look at. Inside the nose, there's a lot of areas that are very sensitive, especially what we call the anterior triangle, which is this fleshy part of the nose here. And it's an area that I guess in close grappling you can get a finger into there to deal with, but it causes a lot of burning, watering of the eyes, blurring of vision, and again, just a lot of discomfort. Okay. Now ears we'll talk about in a second. The mouth and lips have a lot of areas that are sensitive, but I wouldn't encourage anybody to go after them, because most of the areas that are sensitive are in the mouth. And to do that, the person you're grappling with has to have their mouth open, and the masseter muscles here can create a tremendous amount of pressure. It's a good way to lose a finger, or at least get bitten, and that isn't something that you would probably want to have happen. But lips are very tender, and the nose area is very tender. A better place to go for than the nose is right here, underneath the jaw. And if you ever want to get somebody to stand on their toes, all you have to do is one finger, and you can lift them right up, because this is very uncomfortable, either with an index finger or a thumb. So this is an area that's uncomfortable. Now another area that's very uncomfortable, and you folks can even try this, is right behind the jaw here. Just put your fingers here and press a little bit. And it is very uncomfortable to do that. And you can see just with a little bit of pressure how that feels. It's not a comfortable area to go for. But again, in close in, this is an area that you can exert some pressure onto. Ears are very sensitive. They are very sensitive. Nobody likes their ears pulled, tweaked, twisted, and they're hanging out there. So those are appendages that also are available for strikes and for moving. And of course, they cause a lot of discomfort when you do that. And I should also mention with the jaw, it is possible to dislocate it without a great deal of effort. Okay, especially if you grab under here. It's right under where the ear and the jaw meets, and you can grab it, and pulling down, you can actually dislocate somebody. Just slip it right out of the socket. And that's a pretty discomforting feeling for someone to go through.